Explain how the Plan Do Study Act PDSA sickle differs from the Six Sigma DMAIC process in healthcare quality improvement. Provide examples of scenarios where each method would be most effective. Answer: the Plan Do Study Act PDSA ICL is a continuous quality improvement CQI methodology that focuses on iterative testing of changes in real time. It emphasizes small-scale experimentation to test hypotheses before large-scale implementation. The DMAIC define, measure, analyze, improve, control, process part of Six Sigma is a structured methodology aimed at reducing process variation and defects by using data-driven decision-making. Key differences: focus. PDSA is exploratory and adaptable, suitable for environments where solutions are tested and refined incrementally. DMAIC is prescriptive and aims for near-perfect quality by eliminating errors and defects. Feel. PDSA is better suited for smaller, iterative changes. DMAIC is ideal for large-scale, data-intensive projects requiring precision and measurable outcomes. Example applications: PDSA. Testing a new patient discharge process to reduce wait times in a single hospital unit before rolling it out hospital-wide. DMAIC. Reducing surgical site infection rates across a network of hospitals by analyzing root causes and standardizing procedures. Both methodologies align with principles of total quality management (TQM) and lean principles, emphasizing systemic improvement and patient safety. Discuss the relationship between the Joint Committee (EJC) accreditation and healthcare quality improvement. Why is it important for hospitals to maintain TJC accreditation? Answer: the Joint Committee (EJC) sets rigorous standards for healthcare organizations to promote safe, high-quality patient care. Accreditation demonstrates compliance with these standards, which are based on evidence-based practices and federal regulations. Importance: quality and safety. TJC accreditation ensures continuous monitoring and improvement of clinical processes, reducing errors and adverse events. Regulatory compliance. TJC standards align with Centers for Medicare and Medicaid Services (CMS) conditions of participation, which are required for Medicare reimbursement. Reputation and trust. Accreditation signals a commitment to excellence, enhancing patient trust and organizational credibility. Maintaining accreditation involves periodic assessments, performance improvement activities, and adherence to National Patient Safety Goal (NPS). Failure to meet standards can result in penalties, including loss of CMS funding. Dr. Patel is the quality manager at a large urban hospital. Recent patient satisfaction surveys reveal a consistent issue with delayed medication administration. Applying lean principles, what steps should Dr. Patel take to address this issue? Answer: using lean principles, which focus on waste reduction and optimizing workflow, Dr. Patel should identify value, define timely medication delivery as the value desired by patients, map value stream, analyze the medication administration process to identify bottlenecks, e.g., pharmacy delays, nurse workload, eliminate waste, streamline communication between prescribing physicians and the pharmacy, reduce unnecessary steps, and automate where possible, create flow, implement standardized protocols for prescription processing and delivery, continuous improvement, monitor process changes using key performance indicators, KPIs like average medication delivery time and error rates. This approach aligns with Lean's principle of maximizing value while minimizing waste and improving patient experience. What are the key steps in translating evidence from systematic reviews into actionable clinical protocols, and how do these protocols improve healthcare outcomes? Answer: translating evidence into clinical protocols involves a structured process that ensures research findings are practically applied to clinical practice. Critical appraisal. The first step is evaluating the quality of the evidence in a systematic review. Contextual adaptation. Clinical protocols need to be tailored to the healthcare setting, taking into account patient demographics, available resources, and local healthcare regulations. Protocol development. A clinical team, often multidisciplinary, creates a step-by-step guide for care, incorporating the evidence into decision-making, treatment plans, and procedures. Implementation. Protocols are introduced through staff education, integration with EHR systems, and making necessary resources available to support care. Monitoring and feedback. Ongoing data collection on protocol adherence and patient outcomes helps refine the protocol over time. Clinical protocols standardize care, reduce variations in treatment, ensure consistent use of evidence-based practices, and ultimately improve patient outcomes, including safety and satisfaction. Dr. Samantha manages a busy outpatient clinic where patient no-shows are a significant issue, leading to resource underutilization and delays in care. The clinic's current scheduling system is manual and does not send reminders to patients. What strategies should Dr. Samantha implement to optimize patient scheduling and reduce no-show rates? Answer: Dr. Samantha can adopt several strategies to improve scheduling efficiency and reduce no-shows. Automated appointment reminders. Implement an automated reminder system through SMS email or phone calls. Overbooking strategies. Use historical data to adjust scheduling by slightly overbooking, anticipating that a certain percentage of patients will not show up. This ensures that the clinic's time is fully utilized. Flexible scheduling options. Provide patients with options for evening or weekend appointments to accommodate their schedules, reducing the likelihood of missed appointments. Patient engagement and education. Engage patients by educating them on the importance of attending appointments, discussing the impact of no-shows on other patients, and implementing a cancellation policy that encourages accountability. Data analysis and tracking. Implement tracking software to analyze trends in no-shows, identify at-risk patients, and offer them targeted reminders or incentives to improve attendance. What methods can be used to identify bottlenecks in a hospital's emergency department workflow, and how can these inefficiencies be addressed? Answer: identifying bottlenecks in an emergency department workflow is essential for optimizing patient flow and reducing wait times. Process mapping. This method involves creating a detailed diagram of the patient journey through the ED from triage to discharge. It helps identify areas where delays occur, such as slow patient intake, long wait times for diagnostic tests, or delays in bed availability. Time ocean studies. By observing and recording the time spent on each task, such as patient registration or waiting for test results, hospitals can pinpoint inefficient stages that extend patient wait times. Data analytics. Historical patient volume data and wait time metrics can highlight patterns, such as peak periods when delays are more likely, allowing for proactive adjustments. Staff feedback. Frontline healthcare workers can provide valuable insights into inefficiencies, such as understaffing, outdated equipment, or communication breakdowns that cause delays. To address these inefficiencies, hospitals can implement strategies like optimizing staff allocation during peak hours, improving triage protocols, introducing real-time tracking of bed availability, and leveraging technology to speed up diagnostic procedures. Explain the role of critical pathways in managing chronic conditions such as diabetes and discuss their impact on reducing care delivery variation. Answer: critical pathways are structured, evidence-based care plans designed to standardize treatment for specific conditions. They are particularly effective in managing chronic conditions like diabetes by ensuring that all healthcare providers follow a consistent approach. Key components: routine monitoring. Critical pathways define the frequency of necessary tests, such as HBAC monitoring, to track disease progression. Treatment guidelines. They standardize the initiation of medications, such as insulin, and the timing of interventions based on patient needs. Patient education. Pathways include patient self-management education, emphasizing lifestyle changes like diet and exercise, which are crucial for chronic disease management. Regular follow-ups. Scheduled visits for comprehensive care, GI exams, foot care ensure that all aspects of diabetes care are addressed. Impact on reducing variation. By implementing critical pathways, healthcare organizations ensure that every patient with diabetes receives the same high-quality care, reducing the variability seen in treatment. Pathways reduce the risk of overtreatment or undertreatment and ensure that all healthcare professionals follow evidence-based practices. Overall, critical pathways improve patient outcomes, enhance provider coordination, and reduce healthcare costs by avoiding unnecessary tests or treatments. They also improve patient satisfaction as they streamline the care process and increase predictability. Adherence to guidelines from organizations like the ADA ensures the pathways remain evidence-based and effective. How can healthcare facilities optimize capacity planning to balance patient demand and resource availability? Answer: capacity planning in healthcare involves forecasting patient demand and ensuring the necessary resources are available to meet that demand. Effective capacity planning ensures that patient care is delivered efficiently without overwhelming resources. Demand forecasting. Using historical data, hospitals can predict future patient volumes, accounting for variables such as seasonal flu outbreaks, patient demographics, and local health trends. Predictive analytics tools can help anticipate these fluctuations. Flexible staffing. To handle unexpected surges in demand, healthcare facilities can implement flexible staffing models, including the use of per diem workers, float pools, or cross-training staff in different roles. Dynamic bed management. Real-time tracking of bed availability allows hospitals to adjust quickly to changes in patient flow. This may involve discharge planning, admitting patients more efficiently, or transferring patients to less crowded units. Technology integration. Predictive models using historical data can optimize patient scheduling, reduce wait times, and prevent bottlenecks. For instance, electronic health records (EHR) systems can provide real-time information on patient status, enabling quicker decision-making. What are the key factors for successful interprofessional communication in a multidisciplinary team, and how do these factors improve patient outcomes? Answer: effective communication is the cornerstone of successful multidisciplinary teams, especially in healthcare where collaboration between different professionals is critical for patient care. Clear roles and responsibilities. Clearly defining each team member's role ensures that responsibilities are not duplicated and gaps in care are minimized. Shared goals. The team must have common objectives, such as improving patient health outcomes or ensuring safe discharge processes. A shared vision fosters collaboration and accountability. Regular meetings and updates. Daily huddles or team rounds are essential for sharing patient updates, addressing concerns, and planning next steps. This helps ensure continuity of care. Conflict resolution mechanisms. Disagreements are inevitable in high-pressure environments, so it's essential to have protocols in place for resolving conflicts quickly and constructively, fostering a positive team environment. Improved communication leads to better decision-making, reduces medical errors, and enhances patient safety, ultimately improving patient outcomes. Research indicates that hospitals with strong interprofessional communication have higher patient satisfaction rates. Describe the principles of process redesign for improving patient throughput in surgical services. Answer: process redesign is about improving the efficiency and quality of care in surgical services. The key principles are preoperative optimization. By streamlining preoperative assessments and ensuring patients are fully prepared for surgery, e.g., necessary tests, pre-surgery consultations, the likelihood of cancellations and delays is reduced. Standardized protocols. Establishing clear protocols for operating room turnover times, patient preparation, and recovery allows for more efficient use of operating rooms. Parallel processing. Where possible, tasks should be conducted simultaneously rather than sequentially. For instance, preoperative testing and patient preparation can occur concurrently rather than one after the other, maximizing throughput. Technology integration. Implementing surgical scheduling software that allows for real-time tracking and adjustments based on delays can help avoid scheduling conflicts and bottlenecks. Process redesign optimizes operating room utilization, reduces patient wait times, and ensures resources are used effectively. It aligns with principles from frameworks like Lean or Six Sigma, ensuring continuous improvement. Mr. Patel, a 60-year-old patient with hypertension, visits a clinic that lacks a standardized care pathway for chronic conditions. He reports inconsistent medication adherence and frequent ER visits for hypertensive crises. What steps should the clinic take to implement a standardized care pathway for managing hypertension? Answer: to address Mr. Patel's needs, the clinic should take the following steps. Adopt evidence-based guidelines. Begin by reviewing guidelines from organizations like the American Heart Association (AHA) for hypertension management to create a standardized care pathway. Pathway development. Include regular blood pressure checks, specific medication titration protocols, and lifestyle modification counseling, e.g., diet, exercise. Patient education. Educate Mr. Patel about the importance of medication adherence and self-monitoring of blood pressure, as well as the risks of hypertensive crises. Regular monitoring. Schedule follow-up appointments to track his progress and adjust treatments as needed. Staff training. Ensure all healthcare providers in the clinic are trained on the pathway to ensure consistent application. Implementing such a pathway will reduce variability in care, improve adherence, and reduce ER visits. The CDC's Million Hearts Initiative provides tools to implement best practices in chronic disease management. What operational metrics should be tracked to evaluate the effectiveness of patient scheduling systems? Answer: key operational metrics to evaluate the effectiveness of patient scheduling systems include no-show rate, tracking the percentage of patients who miss their scheduled appointments without notice. A high no-show rate often indicates a need for improved reminder systems or patient engagement. Patient wait time. Measuring the average time patients wait before being seen by a healthcare provider. Long wait times may signal inefficiencies in the scheduling system. Utilization rate. This refers to the percentage of available appointment slots that are filled, indicating how effectively the clinic utilizes its resources. Low utilization rate suggests scheduling inefficiencies or overbooking. Appointment scheduling lead time. The average time between scheduling and the actual appointment. Shorter lead times may improve patient access to care. Tracking these metrics provides insights into how efficiently the scheduling system is working and helps identify areas for improvement. CMS guidelines emphasize timely access to care as part of the quality measures that healthcare providers should aim to meet. What are the benefits of implementing continuous quality improvement (CI) in hospital emergency departments, and how can it be applied to improve care delivery? Answer: implementing continuous quality improvement (CEI) in hospital emergency departments, it offers multiple benefits. Improved patient care. CQI focuses on ongoing assessment and improvements in care delivery, reducing wait times and enhancing patient safety by identifying and rectifying inefficiencies. Data-driven decisions. By using real-time data, D staff can assess bottlenecks, identify issues like excessive wait times, and implement timely interventions. Staff engagement. CQI empowers staff to participate in identifying problems and contributing solutions, which leads to higher morale and better patient outcomes. Cost efficiency. By optimizing workflows and reducing unnecessary tests or treatments, CQI leads to cost savings for the hospital. To apply CQI, the D should implement regular audits of care processes, utilize PDSA, Planned Use Study Act, cycles to test and refine solutions, and focus on areas like triage procedures, patient flow, and discharge planning. Explain the importance of the Health Insurance Portability and Accountability Act (HIPAA) in safeguarding patient data. What are the consequences of non-compliance? Answer: HIPAA establishes national standards for protecting sensitive patient health information. 5. It requires covered entities, e.g. healthcare providers, insurers, to implement administrative, physical, and technical safeguards. Key provisions. Privacy rule governs the use and disclosure of PHI. Security rule mandates measures like encryption and secure access to electronic PHI. Breach notification rule requires timely reporting of PHI breaches to affected individuals and the Department of Health and Human Service (HS). Consequences of non-compliance. Financial penalties. Fines up to $1.5 million per violation. Legal action. Civil lawsuits and criminal charges for willful neglect, reputation damage, loss of patient trust and institutional credibility. Compliance ensures not only legal adherence but also the ethical responsibility of protecting patient rights. Why is the Triple Aim framework critical in healthcare quality improvement? Provide an example of how it is applied. Answer: the Triple Aim framework, developed by the Institute for Healthcare Improvement (IHI), focuses on 3 interdependent goals: improving the patient experience, including quality and satisfaction; improving the health of populations; reducing per capita healthcare costs. Application example: a community hospital uses the Triple Aim to address chronic diabetes management. Experience: introduce personalized care plans and telehealth services for patients. Population health: implement community screening and education programs. Cost: reduce emergency visits by improving outpatient management. The Triple Aim fosters systemic changes that balance individual care quality with population-level outcomes. What strategies can healthcare organizations use to prevent fraud, abuse, and waste? Provide examples and relevant regulations. Answer: healthcare organizations can adopt several strategies to prevent fraud, abuse, and waste, focusing on proactive measures, compliance culture, and the use of technology. These strategies include robust compliance programs, establish clear compliance policies and procedures that guide billing, coding, and clinical operations to ensure they align with federal regulations. Healthcare staff should undergo regular training to understand and comply with these standards, helping prevent fraudulent behavior. Regular audits and monitoring. Healthcare organizations should conduct internal and external audits of financial transactions, patient records, and claims to detect any discrepancies or irregularities. This helps identify and address potential fraud before it becomes an issue. Use of data analytics. The use of analytics tools to detect unusual billing patterns or duplicate claims can help identify waste and fraudulent activities early. Healthcare organizations can employ these tools to flag suspicious transactions automatically. Whistleblower protections encourage reporting of unethical behavior through confidential channels, ensuring staff feel protected under laws like the False Claims Act (FCA) and Whistleblower Protection Act, which protect individuals who report fraud. Regulatory compliance. Strict adherence to laws like the STARP law, which prohibits physicians from referring patients to entities in which they have a financial interest, and the anti-kickback statute, which prevents bribery and kickbacks for services paid for by federal healthcare programs. By implementing these strategies, healthcare organizations can reduce the risk of fraud, abuse, and waste, thereby improving both financial performance and ethical integrity. Describe the potential consequences of failing to address disparities in care delivery within a healthcare organization. Answer: failing to address disparities in care delivery can lead to severe consequences for both the healthcare organization and the patient population. Negative impact on patient outcomes. Disparities in care, such as unequal treatment based on race, gender, or socioeconomic status, often result in poor health outcomes, including higher rates of morbidity, mortality, and complications among underserved populations. Legal and regulatory risks. Healthcare organizations that fail to address care disparities may face legal action under Title VI of the Civil Rights Act of 1964, which prohibits discrimination based on race, color, or national origin. Failure to meet these requirements can lead to lawsuits, government investigations, and loss of federal funding. Financial repercussions. Organizations may experience decreased reimbursement from programs such as Medicare or Medicaid if they fail to meet quality standards set by value-based reimbursement models. Reputational damage. Public awareness of disparities in care can damage the healthcare organization's reputation. This loss of public trust can affect patient retention, reduce community engagement, and hinder the organization's ability to attract and retain skilled healthcare professionals. Dr. Emily, a leading surgeon in a hospital, receives a gift worth $2,000 from a pharmaceutical company whose products she regularly prescribes. What actions should Dr. Emily and the hospital take to address this situation ethically and legally? Answer: disclose the gift. Dr. Emily must promptly disclose the gift to the hospital's compliance office. Transparency is key to preventing conflicts of interest that could affect patient care or the integrity of clinical decision-making. Review hospital policy on gifts. Healthcare organizations usually have strict policies regarding the acceptance of gifts from pharmaceutical companies to avoid any appearance of impropriety. The hospital's policy will likely require that gifts above a certain value be returned or donated. Dr. Emily may be asked to return the gift or donate it to charity to comply with hospital guidelines. Compliance with anti-kickback laws. The anti-kickback statute prohibits any exchange of remuneration, including gifts, to induce or reward referrals for services covered by Medicare or Medicaid. The hospital and Dr. Emily must ensure that no improper financial relationships exist that could lead to potential violations. Training and preventative measures. Regular training should be conducted to raise awareness of ethical standards and compliance with regulations such as the Sunshine Act, which mandates transparency regarding financial relationships between healthcare providers and the pharmaceutical industry. Explain the importance of health information exchange (HIE) in improving patient outcomes. Answer: health information exchange (HIE) plays a critical role in improving patient outcomes by ensuring seamless communication and coordination of care among healthcare providers. The benefits of HIE include continuity of care. HIE allows healthcare providers to access a patient's complete medical history regardless of where care was provided. This ensures that care is continuous and that important clinical information such as allergies or previous diagnoses is available in real time, reduced redundancy and errors. By sharing patient information electronically, HIE helps reduce duplication of tests and procedures, thereby saving costs and avoiding unnecessary procedures. It also reduces the likelihood of errors due to incomplete or outdated information. Improve patient safety. HIE can provide clinical decision support by alerting providers to potential drug interactions or contraindications. For example, an HIE system can flag a medication order that could be harmful based on the patient's history of allergic reactions or existing conditions. Regulatory compliance. The HIT-CH Act and meaningful use incentives encourage healthcare providers to implement HIE systems to improve the quality of care and patient safety. How do clinical decision support (CDS) tools aid in reducing medical errors? Provide examples. Answer: clinical decision support (CDS) tools significantly enhance patient safety and reduce medical errors by providing real-time, evidence-based recommendations to healthcare providers. The key ways in which CDS tools help reduce errors are automated alerts and reminders. CDS tools can alert healthcare providers to potential drug interactions, allergies, or inappropriate dosages. For instance, a CDS system might issue an alert if a prescribed medication interacts with another drug the patient is taking, preventing harmful drug reactions. Evidence-based recommendations. CDS systems can suggest treatment options based on clinical guidelines, reducing variability in care and ensuring that providers follow the best practices. For example, when treating a patient with a chronic condition like diabetes, a CDS tool can suggest the most appropriate treatment options based on the latest research. Guidelines compliance. CDS tools ensure that healthcare providers adhere to national and institutional clinical guidelines, such as those established by the Joint Commission or the National Institute for Health and Care Excellence (NICE). This reduces the chances of medical errors caused by outdated or inconsistent practices. Decision-making support. By presenting evidence in real time, CDS tools help healthcare professionals make better clinical decisions. This reduces cognitive overload, allowing providers to focus on the most critical aspects of patient care. CDS tools are therefore essential for reducing errors, enhancing clinical decision-making, and improving patient outcomes. The hospital plans to implement a new EHR system. During a pilot run, staff report difficulties in accessing patient records due to system downtime. What should the hospital do to address the technical and operational challenges? Answer: technical investigation. The hospital's IT team should immediately investigate the cause of system downtime, whether due to server overload, software glitches, or network issues. Identifying and addressing the root cause is crucial for minimizing disruptions. Backup systems and redundancy. To ensure continuity of care, the hospital should have backup systems in place, such as paper records or offline access to critical data during downtimes. Implementing redundant systems, such as cloud storage, can further mitigate risks. Training and support. The hospital should offer additional training sessions to familiarize staff with the new system, ensuring that users are comfortable navigating the EHR system and are aware of how to report technical issues. Vendor collaboration. The hospital should work closely with the HR vendor to troubleshoot and resolve technical issues. The vendor should be required to provide timely technical support and system updates. Compliance with HIPAA. Even during technical difficulties, the hospital must ensure that patient data remains secure. The hospital must comply with HIPAA to protect patient privacy even when troubleshooting system issues. Testing and feedback mechanism. The hospital should conduct thorough testing before full implementation and create a feedback loop where staff can report difficulties and suggest improvements. This helps refine the system for better functionality. By addressing these areas, the hospital can minimize downtime, improve HR usability, and ensure patient data remains secure and accessible. What are the key components of a successful quality improvement (CAI) initiative in healthcare, and how can they impact patient outcomes? Answer: a successful quality improvement (CAI) initiative in healthcare includes clear goals, data analysis, interdisciplinary collaboration, patient-centered care, and continuous monitoring. Clear objectives. Establishing measurable goals like reducing hospital readmissions within 6 months helps direct efforts toward improving specific outcomes. Data collection and analysis. Healthcare organizations collect data on clinical outcomes, patient satisfaction, and processes to identify areas for improvement. Statistical tools like SPC charts track trends and measure the effectiveness of interventions. Interdisciplinary teamwork. Effective QI requires collaboration between doctors, nurses, and administrators. For example, reducing surgical complications requires input from the entire surgical team, ensuring safe practices are followed at every stage of care. Patient-centered care. Involving patients in their care planning improves compliance with treatment plans, reducing readmission rates. Ongoing monitoring. Continuous evaluation using frameworks like PDSA cycles ensures that improvements are sustained. Regular monitoring allows for necessary adjustments based on real-time data. How do federal and state healthcare laws influence healthcare quality and patient safety? Provide specific examples of relevant legislation. Answer: federal and state healthcare laws establish standards for patient safety, quality care, and accountability. Notable examples include the Affordable Care Act, ACAT, promotes value-based purchasing, VBP, and accountable care organizations, ACOs, which incentivize quality over volume by linking reimbursement to performance. Medicare and Medicaid COPs set standards for hospitals to receive reimbursement, focusing on patient rights, safety, and care processes, ensuring minimum quality levels. HIPAA ensures patient data privacy and security, facilitating better communication and reducing the risk of errors due to incorrect or incomplete information. State-specific regulations. Laws like California's Safe Patient Handling Law focus on patient safety by regulating handling procedures to reduce injury risks for patients and staff. Together, these laws enforce quality standards and incentivize healthcare providers to adopt best practices, improving both patient outcomes and operational efficiency. James, a 68-year-old male patient with heart failure and diabetes, has been frequently readmitted due to poor medication adherence. The hospital has a care transition program that includes follow-up calls, education, and medication reconciliation. What steps should the hospital take to prevent James readmissions? Answer: personalized discharge plan. Create a tailored plan addressing James' specific needs, including medication instructions and follow-up appointments. Medication reconciliation. Ensure that James understands his medications through one-on-one sessions with a pharmacist, emphasizing adherence. Post-discharge follow-up. Assign a nurse or care coordinator to contact James within 4872 hours to check on his progress and address any issues. Telehealth monitoring. Use remote monitoring to track his vital signs and intervene early if complications arise. Community resource collaboration. Address social factors by coordinating with local organizations for transportation or meal services. These steps help improve care continuity and reduce readmission rates by providing James with the necessary support to manage his conditions. How does electronic health record data analytics contribute to quality improvement and decision-making in healthcare organizations? Answer: HR data analytics improves healthcare quality by providing real-time insights for decision-making. Key contributions include identifying patterns. HR analytics identifies trends in patient outcomes such as high rates of infections post-surgery, allowing targeted interventions, supporting clinical decisions. Alerts about potential drug interactions or abnormal lab results guide clinicians in making safer decisions. Monitoring guideline adherence. Analytics helps track compliance with clinical guidelines, ensuring patients receive evidence-based care. Improving efficiency. HR data streamlines operations by pinpointing inefficiencies like long wait times, enabling resource optimization. Benchmarking performance. HR systems enable comparison with national standards, highlighting areas needing improvement and fostering continuous quality enhancement. By integrating HR analytics, healthcare providers can optimize patient care, improve operational efficiency, and maintain high-quality standards. MS Rivera, a nurse manager, observes inconsistent documentation practices among her team, potentially affecting compliance with ISO 9001 standards. What steps should she take to address this issue? Answer: MS Rivera should conduct a gap analysis, identify discrepancies between current practices and ISO 9001 documentation requirements, provide training, educate staff on the importance of consistent and accurate documentation for quality assurance, standardize procedures, develop and implement uniform templates for clinical notes and records, monitor compliance, use periodic audits to ensure adherence to standardized practices, feedback and improvement, encourage staff to report challenges and refine procedures as necessary. ISO 9001 emphasizes systematic documentation as a foundation for consistent quality and regulatory compliance. Compare the Don-Abedian model with the Baldrige Performance Excellence Framework in evaluating healthcare quality. Answer: the Don-Abedian model focuses on three elements to assess healthcare quality: structure, the environment and resources, e.g. facilities, staff, process, the methods of care delivery, e.g. treatments, protocols, outcome, the effects of care, e.g. recovery rates, patient satisfaction. The Baldrige Performance Excellence Framework provides a broader organizational view, emphasizing continuous improvement across 7 categories: leadership, strategy, customers, measurement, workforce, operations, and results, while Don-Abedian focuses on clinical quality through structure, process, and outcomes. Baldrige evaluates the overall performance of the healthcare organization, including leadership, strategy, and employee engagement. Both frameworks aim for improved quality, but from different perspectives. Don-Abedian is clinical and Baldrige is organizational and systemic. How do the National Patient Safety Goal (EPIDS) enhance compliance with the Joint Commission (EJC) standards? Answer: the National Patient Safety Goals (EPIDS) are established by the Joint Commission (EJC) to help healthcare organizations improve patient safety by focusing on high-priority issues. The NPSGS are updated annually and serve as a guide to healthcare facilities in ensuring safe and effective patient care. The goals are designed to reduce the risk of adverse patient outcomes by addressing critical areas of safety. For instance, the goal of identifying patients correctly emphasizes the importance of verifying patient identity using at least 2 patient identifiers, which reduces the risk of misidentification and medical errors. Other NPSGS focus on improving communication, such as the goal of improving communication among caregivers. This encourages the use of standardized handoff processes to ensure that patient information is consistently and accurately transferred between healthcare providers, reducing the chance of errors during transitions of care. Additionally, the NPSG on medication safety emphasizes accurate labeling of medications and the safe administration of high-risk medications to minimize harm. These guidelines directly contribute to achieving compliance with TJC standards, which ultimately enhances the overall safety and quality of patient care. What role does the Centers for Medicare and Medicaid Services, CMS, play in promoting quality care? Discuss the role of waste reduction in lean healthcare and provide examples of the 7 types of waste. Answer: the Centers for Medicare and Medicaid Services (CMS) plays a pivotal role in promoting quality care through a combination of regulatory frameworks, quality reporting, and payment incentives. CMS oversees the administration of key healthcare programs such as Medicare and Medicaid, which together cover a substantial portion of the U.S. population. To ensure that these programs support high-quality care, CMS implements several strategies. Reimbursement policies. CMS has tied reimbursement rates to the quality of care provided under programs like value-based purchasing (VBP). Hospitals and healthcare providers are financially incentivized to improve patient outcomes and reduce costs. Quality reporting. CMS mandates quality reporting through initiatives like the Hospital Compare website and the Hospital Readmissions Reduction Program (HRE). Healthcare providers are required to report on a range of quality measures, including patient satisfaction and remission rates, which directly impact CMS reimbursement levels. Innovation models. CMS supports initiatives like accountable care organizations, ACOs, and bundled payments to promote coordinated, cost-effective care. ACOs aim to enhance collaboration between healthcare providers, improving patient outcomes while reducing unnecessary spending. Answer: lean healthcare aims to eliminate waste and improve efficiency. The 7 types of waste in lean are: defects, e.g. medication errors; overproduction, e.g. unnecessary tests; waiting, e.g. patient delays; non-utilized talent, e.g. underused staff; transportation, e.g. unnecessary movement of materials; inventory, e.g. overstocked supplies; motion, e.g. excessive movement of staff. By eliminating these waste types, lean principles improve care efficiency, reduce costs, and increase patient satisfaction.